Hello friend, welcome to this video. This video, I want to address one of the common questions that has been asked by interns and residents, that how to do pre-round productively and efficiently. Because, you have very limited time in the morning to round with all the patients you are following up to prepare for your round with the attending physician. So let's jump right into it. Before that, if you are new to this channel, welcome. If you are coming back, thank you so much for joining again. I know that this video will keep up your positive vibe. My name is Dr. Farzana Hoque. I'm an associate professor of medicine currently practicing in the US. So let's now address the question of this video is that how to do bedside round. I will share my video so that it will be much easier for you to follow. So as you can see in this screen, we are talking about how to do bedside round. And for this, I want to introduce a very easy mnemonic, which is round. Now let's work together to find out what is round this mnemonic and how you can utilize it. First is R for review concerns. In the morning, you must ask and address patient's concerns. As intern, as resident, if you do not know what is the immediate response to address the patient's concerns, you must write down so that you can discuss with your attending physician and address it during the formal rounding. Because if you do not know what is the patient's acute concerns or overnight events, there is a high risk that you will miss a lot of the important facts that is critical for patient safety. Second is O. O for outline current status. What is the current status of your patient? Is the patient stable or does the patient need anything to be done that day? What is the biggest thing you are doing for that patient? Maybe, patient is waiting for a surgery. Maybe you are waiting for a critical lab that will decide your treatment plan. So outline what is the current status of this patient. Maybe patient's family is at bedside. If the patient is stable, they need to know, or if the patient is sick, they need to know that as well. So emphasize the current status. Then is U. U for updates. This update could be any new medication. This update could be any important lab result or maybe biopsy result or any kind of procedure finding that you need to update the patient and patient's family. One teaching point is that if you are starting any new medication, do not wait for the last moment or do not wait for the discharge date to educate the patient. Take the opportunity of this morning round and talk briefly about what is the important update in their medications, in their labs. Then N is for next step. What is the next step for this patient? Is the patient going to be discharged soon? Or are you predicting that, okay, a couple of more days need to be done for this patient? Are you waiting for any important test results to decide what will be the next step for this patient? Maybe this patient is waiting for surgery today. That is the next step. And after that, your next step is resume the diet order. So talk about your plan for this patient's next step during this hospitalization and particularly for that day. And D is for discharge planning. We know that when patient get admitted, it is not safe to keep them even unnecessarily, even for few hours because of hospital acquired infection and also for their personal reasons as well. Because nobody likes to be in the hospital more than they need to be. So, what is your plan for this patient safe discharge? Ask yourself when you are reviewing the chart that what are the barriers for this patient safe discharge? Maybe this patient need prolonged IV antibiotics. Maybe you need to set up all those antibiotics arrangement for discharging the patient. Or maybe you are waiting for any other consultant team's recommendation to finalize that okay when this patient can be discharged. Or maybe you are waiting for any surgery team's recommendation. For example, patient is on wound vac, when that wound vac will be removed, so you know when is the discharge date. So think about what are the barriers for patient safe discharge so that you can address it and prepare yourself before going to the round to discuss with the patient. And I can bet you when you will follow this mnemonic round during your morning side round, and also when you are preparing yourself how to present this case to your attending physician, you will be much, much better prepared to address patient's questions as well as your attending's questions. So I hope you found this mnemonic helpful. And if you want me to address any other topics or questions, please put it in the comment section. I review them very thoroughly. And please subscribe to this channel because your support means a lot and gives me inspiration to make more educational videos that you can utilize for your professional growth. I will see you in the next video, and until then, take care. Peace out.